Time for the news. In our first story, we have to take you to the Upper West region, and it's where the Deputy Minister for Health, Dr. Okoboy, has reiterated government's commitment to fighting the cerebral spinal meningitis in the region. Now, speaking during a courtesy call on the Upper West Regional Minister, Dr. Hafiz bin Saleh, Dr. Okoboy said government is not only focused on fighting coronavirus, but also CSM and other infections as well. Correspondent Rafiq Salam has the rest of the story.
The two-day working visit to the Upper West region by Deputy Minister of Health, Dr. Okoboy, is to do a close review of the various strategies employed by the various districts and municipal public health epidemic management committees in the region to fighting the high number of fatalities on the cerebrospinal meningitis CSM and their preparedness to combating the COVID-19 pandemic. Whilst in the region, he is scheduled to meet major stakeholders in the health sector, including traditional and opinion leaders, and visit some centers where COVID-19 patients are being held. Dr. Okoboy's first point of call was at the Upper West Regional Coordinating Council, where he paid a courtesy call on the Upper West Regional Minister, Dr. Hafiz bin Saleh.
In the case of COVID-19, we have recorded 8 cases, and all the 8 cases are doing very well. On the part of CSM, as of now, we have recorded 273 cases with 43 deaths, and this is not pleasant at all. Since the situation became unbearable, we have had cause to inform the Ministry of Health as well as Ghana Health Service, and they have not taken their eyes off the ball. In fact, the Director General, Ghana Health Service, a few weeks ago had to deploy the Director Disease Control and Prevention Department of Ghana Health Service to the region. He came, assessed the situation, and has since presented his report to the Director General.
Dr. Okoboy reiterated government's commitment to fighting the CSM epidemic and other infectious diseases in the country. He said the loss of 43 persons in the region through CSM cannot be allowed to continue.
Government hasn't taken its eye off the ball when it comes to other health conditions. We are dealing with COVID-19, but we put equal importance on conditions like CSM. When you look at the WHO protocol, the case fatality rate that is accepted or more or less considered as normal is when it's less than 10%. But we know that over the past few months, when you look at the cases from the Upper West, we've gone to about 15 or so percent. So we appreciate the fact that it is quite high, and my small research has shown that some of the strains of bacteria that we are dealing with now is not the usual ones that have vaccines readily available. We are dealing with Sero-X, I am told, and the plan is quickly to find a way to encourage and educate people to do early reportage to the hospitals. I believe I'll get to know more as we interact with the stakeholders and the managers of the situation.
Later, at a meeting with the Upper West Regional Public Health Epidemic Committee, outgoing Upper West Regional Director of Health Services, Dr. Oseko Afrea, threw more light on the district municipal distribution of the CSM cases, stating that all confirmed cases have been treated and discharged, except 5 who are currently receiving treatment.
So these are cumulatively the number of cases that we got. So if you take the 43 out of the 273, then obviously the rest are cases that have recovered and we have discharged them and they are living a healthy life. Exactly, because others have been treated and discharged. So if you go to Nadoli right now, they have just 1 case, who is an under 10-year-old child. You go to Jirapa, there is no case on the ward. You go to Nandom, they had 2 cases yesterday, and this morning they brought a 45-year-old presenting with signs.
Reporting for Joy News, Rafiq Salam.
We now take you to the Bono East region, and it's there where we go to explore rural towns who do not get many outside visitors. but people who live in them drive to larger cities all the time in this period of coronavirus. And these people are increasingly likely to be exposed to the disease on those trips. Several of these communities, including Akisamaso in the Bono East region, have been neglected in the distribution of hand-washing facilities by Ghana's authorities. Now, following an earlier report by Anna Sabit on the lack of potable water in this community, a non-governmental organization has donated hand-washing tools to help stop the spread of coronavirus.
Social distancing refers to a way of creating a barrier of physical distance between two or more people so that transmission of viruses can be prevented or halted. This simple health directive is being observed in most urban areas since the outbreak of the COVID-19 pandemic. But how about those living in rural communities like Akisamaso, a community under the Techiman South municipality of the Bono East region?
Some people know, but others don't know. But it's their mind that while they are in village, the sickness, coronavirus cannot come here. That's the reason why they are doing that. They thought maybe it's in the big cities.
The people here neither have enough education on the deadly virus nor basic protective gears like the hand-washing kits. 18-year-old Edith Dante shares with me how the people here have been observing the basic hand-washing protocols.
They use their own basins. They wash it inside the basin. Instead of them to wash it under running water, they wash it in their own basin with soap, but they don't have the hand sanitizer.
Following a Joy News report on the unavailability of potable water for the people in this community, Pirim African Youth Development Platform, in partnership with the UNFPA, donated items including Veronica buckets, gallons of liquid soaps, nose masks, hand sanitizers, amongst others, to this community. Millicent Oklo is the Bono East regional representative of PDP.
Looking around, there is no Veronica buckets situated anywhere in the community, and realize that most of them are ignorant about the hand washing. I think visiting them and then donating this to them, we've enlightened them on washing their hands. I think that it's very good that we came here, because they don't even know that they need to distance themselves. They do know that they are supposed to use sanitizers, because they have little knowledge or information about this thing, so that to prevent them from contracting the virus.
She called on authorities to extend education and help to rural communities in order to stop the spread of the pandemic.
I think attention should be paid on rural communities, because these people are very vulnerable. Because even their road to their communities, I don't think anybody will even thought of them, but I think their attention should be paid, because go to several communities, they don't have any form of means to wash their hands or sanitize anything. So it's very necessary that attention is being paid to such communities.
Some of the people we spoke with also called for more support from government.
Yes,
if possible, there should be more of this donation for this village.
Reporting for Joy News, Anas Sabit, Akisamaso.
Back here in Accra, another non-governmental organization, Basic Needs for the mental health sector, has debunked claims that people with mental disabilities are immune from COVID-19. Now, according to Project Officer for Basic Needs, Sunday Anaba, government must be concerned about many of them roaming freely on the street in this time of the infection. Ghana Federation of Disability and hundreds of vulnerable people in Accra were beneficiaries of relief items from CSO platform on sustainable development goals. PSA Nanaya Osafo has more.
As the toll of global pandemic continues to rise, worst hit remain the poor and vulnerable, as well as many people with disability who barely have the means to compete economically. For many people with disability who already suffer labor discrimination and massive unemployment, the times have taken a darker turn. Many go to bed without the satisfaction of a single meal in a day.
We present it to you in the name of God the Father, the Son, and the Holy Spirit. Amen. Amen.
The Ghana Civil Society Platform on Sustainable Development Goals gave over 200 bags of rice, gallons of oil, soap, sachet water, and vitamin C capsules to persons deemed vulnerable in the society. 20% of items were earmarked for the aged and widows, 15% for the mentally challenged, 25% for persons with disabilities, and 40% for street children. Some members on the platform include the Ghana Anti-Corruption Coalition, Send Ghana, and the Star Ghana Foundation. Co-chair of the CSOs behind the initiative, Joyce Lanyo, said the reason for the move was to try to bridge the gap between the rich and poor that may be worsened by the global pandemic and to help government live up to the task.
The civil society platform and its partners in the wake of the COVID-19 national emergency established this fund to complement and support the varied efforts being executed by the government of Ghana. The response fund is intended to coordinate in a concerted manner the efforts of actions of all civil society organizations, networks, associations, and to leverage on the strengths we have in our numbers to impactfully address some of the inequality challenges that the COVID-19 pandemic may create in the spirit of leaving no one behind.
The Ghana Blind Union received items on behalf of the Ghana Disability Federation. Other beneficiaries given food for distribution were the Gamashi Development Committee in Jamestown, Aid Aged Foundation in Kaswa, and a few selected outfits in the Ashanti region. Executive Director of the Ghana Blind Union, Dr. Peter Obiya-Samoa, called for special distribution methods of national relief packages for the disabled, as many are being left behind.
We need to have more of this support coming from government side, okay, for our members, because look, the initial distributions like that, many of our members didn't benefit from these things, because we are most of the time indoors and we are not getting the information. If you just lump us into persons with vulnerable when you are distributing things, it's likely that in most cases blind people would not be able to access that kind of support. Economic stimulus packages and things. You'd also remember that there are persons with disability who also need to benefit from these economic stimulus packages.
Project Officer of Basic Needs, an NGO for mental health and development, Sunday Anaba, agreed that the situation was same for the mentally challenged.
With this COVID-19 response, and that is why we come in, and that is the difficulties we are experiencing, there have been support to people in the communities who are termed as vulnerable. But when you also get to the communities, among the vulnerable, there are people who are even more vulnerable. And so when the support gets to the community, some people get it, but the people who are even more vulnerable are not able to get this access. I am here, I work with our volunteers, I work with our self-help group chairpersons and then chairmen, and they give us reports that yes, they have brought support to their communities, but they are not able to access it.
He debunked the supposed immunity of the mentally challenged from COVID-19 and called on district assemblies to take streetism among the sick more seriously.
There has not been any study that has been published to say that people with mental illness are exempted from getting COVID-19. So they being on the street, which they are still on the street, is also just a point that we need to look at. That even when all of us are inside, and there are still people outside who can easily contract the diseases, and one way or the other can give it to us. So as a government, what do we need to do? The Mental Health Act that was passed in 2012 also looks at paying attention to people with mental illness, and it puts the responsibility of people with mental illness, wherever they are, under the district assemblies. So this is the time that the district assembly will have to also look at the Mental Health Act and see what they can do. If they have to provide temporary accommodation for them within this period and provide them some feeding for the period so that they can even provide, it will even be a basis in which they can even get them treatment. They can get them a psychiatrist to be reviewing them for some time. Then they will also protect them from getting the diseases.
PSA Nanaya Osafo, Joy News.
And before we go, a Ghanaian artist, Kwame Akoto Bamfo, is creating sculptures of people who are victims of the slave trade to help the current generation of Africans immerse themselves in the traumatic experiences. Well, Mr. Bamfo's installation, which uses a Adinkra symbol to paint one's journey, has traveled around the world in major museums, including the National Memorial for Peace and Justice, that's based in the United States of America. Justice Baidu went to meet him at his workshop in Adan.
What did slavery and colonialism leave to us as a people? From what I learned in books, it's almost implied that the continent started when Europeans came to Africa. These particular ones are captured snapshots of our enslaved ancestors who were taken from various parts of the continent, taken to other places in Europe to go and work, and then suffered, inhumane treatment. That's what I try to represent with these heads. Hence the various expressions of pain, sadness, remorse, all the expressions that you can gather for 600 years that the slavery took place. Chim is both an Adinkra symbol, and for an Akan word, it's also symbolic of our travels. The installation goes back to refer us to who we are or where we came from, and then where we can go once we have an understanding of, what we've been as a people. If we know what we have done before, and we understand that we've been through a traumatic experience, that we are not a lazy people, we are not unintelligent people, then we can heal faster and develop the continent faster.
Well, so we're back, and as it is, Kojo Yankson will be joining us soon. You'll see him on the screen.
It's a double of me.
Yeah, it's good. It's still going through. Just bringing to you what it is. But before we get all right, Kojo Yankson, how are you?
I'm very well. It's wonderful to see you both. Oh, Mama Beezy, looking good.
Yo, baby.
Yeah.
Thank you.
Well, I have to say that it's also the birthday of Richard Kwadwo Nyarko.
Yes.
Our main Central Regional correspondent. Richard, wherever you find yourself this morning in the Central Regional capital of Cape Coast, have a great morning. It's from all of us right here on the show, and Joy News as well. And Richard.
Kwadwo, can we have you sing like a birthday song or something?
Oh, no, wait.
Absolutely. But
I haven't finished. Tobo.
I've known him since before I joined Multimedia. But also, can we say happy birthday to my sister, Jenny Yankson Latte, who is helping on the front line to fight COVID-19 as a consultant with the NHS in England. So can we do it for the two of them?
Yeah, you will. So are you ready?
Yeah.
Go for it.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Richard Kwadwo Nyarko and my sister Jenny Yankson Latte. Happy birthday to you.
Yay! Hip, 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 hip.
Well,
I give you some watch it today. Thank you for doing it. Happy birthday to Richard Kojo Nyako, our man in the central region.
Well,
and of course, to Kojo's sister Jenny. Happy birthday to you as well. Thank you for being on the front line.
Yeah, it's also your birthday, Rebecca Sapak, and do enjoy your birthdays also from all of us right here, and also from your son Evan, and then also lawyer Emmanuel Labi Amwa, or popularly called Barbados. Well, Johnny Hughes of TV3 said I should wish you, so good morning to you as well. Enjoy your day.
Okay, all right. So if it's your birthday, you haven't heard your name, we love you, we wish you a happy birthday. Let's do the papers, guys. I'll start with the Daily Graphic newspaper. Here's what's on the front page of the Daily Graphic. COVID-19, plight of workers, labor unions want tripartite engagement. It comes with a picture of Kwabena Nyako Otu, the director of the research and policy at the TUC. COVID-19 testing begins at UHAS laboratory. Also, VRA assures of sustained power generation. In the meantime, I have been going off like every day in my neighborhood.
No.
And it doesn't go off once, like it does the doomso, and then doomkra for hours before it comes back on. But that's, for me, who experiences that, I don't know what to make of this assurance by the VRA. But the
normal.
thing is, I don't know where the problem is coming from.
Your predicament is called localized power cut.
So it's not doom, so it's localized.
Localized.
The center spread of the paper, Center for Plant Medicine Research working on herbal cure for COVID-19. Businesses, organizations enforce compulsory wearing of nose mask. And government delegation in Upper West assesses CSM COVID-19 situation. On the back page of the graphic, 3 landfill sites shut over non-payment of services. A very worrying situation, says the company has relied on regular payments from the government to maintain good service levels across various sites. But since the beginning of 2017, these payments have not been regular. Also report fall armyworms early. That's an appeal from the Ministry of Food and Agriculture. It's advised farmers to monitor their fields frequently for early detection of fall armyworm infestation. My last paper is the Daily Statesman. So let's do the Daily Statesman newspaper, front page. Battle for Baumiers Bita, Dufour, Zenato forcing in final race. Mahama to announce running mate in May, according to the paper. Also, Education Minister urges parents to support kids at home. And Akufo-Addo walks his talk. Gabi replies, NDC says. It's on the 88 new health facilities that the president announced. All right. Kojo?
Yeah, I have the Ghanaian Times and the Daily Guide. So I'll start with the Ghanaian Times. And the banner headline this morning, Fall Armyworm Invasion Again. It's got a picture of the Agric Minister with that story. And it says, Ministry of Food and Agriculture alerts farmers in 8 regions. Also on the front page this morning of the Ghanaian Times, COVID-19, GIS launches manhunt for over illegal entry into Ghana. Also this morning, Kolebu embarks on mass PPE production. Freight forwarders react to nationwide rollout of Unipass. Now, this is a story that doesn't seem to go away. Unipass and their establishment of a system at the ports. We really ought to make some time for that one when we get the opportunity. Let's flip the paper over. Look at the back page. ASLOD disinfects VRA and Tico catchment communities. And Ho West District Assembly to plant 15,000 trees to protect water bodies. Now, in the center spread of the Ghanaian Times this morning, a couple more stories. Kolebu embarks on mass PPE production. This is great news. Many companies have gone into this sector to help in the fight against COVID-19. It's good to see Kolebu leading the way there with their own production unit. Also, COVID-19, GIS launches manhunt for 3. I've mentioned that already. over illegal entry. All right, let's do the daily guide real quick. This morning, they've got to one of their typical headlines, NDC dazed over 88 hospital agenda. Now, also on the front page, exhumed bodies of Ubini dead girls can demand. You know, there's been this thing going on now for weeks between Kennedy Agyapong and Bishop Ubini, who sounds more and more like he's bitten off more than he can chew. But the latest from Kennedy Agyapong is a call for the exhumation of some bodies. Right, NLA makes strides, and also on the front page, Daily Guide reviews cover price. That's probably something we're going to start seeing a bit more of in the print media. Also, defunct banks' CEOs' cases get May adjournment, and 13 doctors hit by COVID-19. Perhaps we can talk a bit more about that one later. On the back page, a few sports stories. Kotoko sever ties with 3. Isolation is hard, to be honest, and shocked by Paraguay ordeal, as well as FIFA proposes 5 substitutions per game. I wonder what you think of that, Mama B.
Well, I'm not sure. I'm not sure, actually. Like, this is a bit awkward on the surface.
Well, what, 5 substitutions in the game?
It's not like the game that we know. I mean, why do they keep changing football? 5 subs, like how? Who will be tired? Like, nobody will be tired. It's part of the, I mean, getting tired is part of the game. So I don't know if you have those many options. I don't know.
Maybe they want to, you know, the way American football or rugby or basketball does it.
Traditional
you
football.
commit a certain foul, you go in and out.
They already introduced the VAR. I mean, it doesn't make it really look like football. And then now this one.
Well, VAR is in tennis.
You don't like VAR either?
Nah, not in football. I like it in tennis, not in football.
Hey.
Yeah.
They can choose VAR.
It's like introducing VAR in gutter to gutter. Like how?
Futsal. Yeah.
Although, I mean, to be fair, the 5 substitution thing, I think it's more of towards strategy, right? They want to be able to make more room for strategy in the game. Do you think that will sort of not make the game
that's
better?
all like a digitized kind of something. Doesn't work for me. I don't know. Roland, works for you?
For me, I think the 3 substitutions are okay. Yeah, because it means we have 11 players on the field, and if you have the opportunity to substitute 5, it also means that, well, you keep the tempo of the game very hot, but at the end of the day, almost like a gridlock. I mean, I'm thinking almost like a gridlock.
Let the players get tired. Let somebody defeat them.
Yeah.
Because 5 would be like half of your team, right?
Yeah.
Almost, yeah. Yeah, the outfield players, with the exception of the goalkeeper, of course.
But this is still something that they're considering, that they're looking at. It's not like they've introduced it.
Well, they're proposing it, and I mean, it's FIFA proposing it. So who is going to say yes or no to them?
Exactly.
But the teams, the countries, well, we'll see.
Well, the thing is that everything that is being proposed within such governing bodies usually is implemented one way or the other.
Thing is, we have too much time these days, so people are thinking about all sorts of things. Yeah, I think that's
Lockdown is back. Yeah. It's back for us all.
You're done with the papers, though?
Yes, I'm done with the papers.
Well, I have the last paper. The Chronicle has on a front page, Shippers Authority beat a hasty retreat on demurrage orders. It has a picture also of the Ghana Standards Authority, or the Ghana Shippers Authority has to be, Benonita Bismarck. Easing restrictions will lead to death sentence on Ghanaians is an editorial, an opinion by experienced journalist Ibu Kwanzaa. Down there we have CSM, that will be cerebral spinal meningitis, ravaging Upper West region, over 40 dead. And there was a visit by the newly sworn in Deputy Minister for Health, Dr. Okoboy, Pharmacists Forum charges Koa Herbal Center to stop fighting FDA. It's an ongoing feud between the two, or impasse, depends on how you want to look at it. Your money-making interest should not endanger Ghanaians, President says, called from his last address to the country. All right. Now let's go to the Daily Dispatch. It will be on your screens, and it has on the front page a number of interesting stories. Also, it also is well captioned, and this one source to beneficent. Disregard for social distancing will cause a second lockdown soon, predictably. He's not the first saying this. It's a concern for many people, and we'll see how it goes. The president, though, says that his actions are backed by data and science. Down there, NDC reacts to EIU's prediction, that's the Economic Intelligence Unit's prediction, that Akufo-Addo likely to win 2020 elections. Hospital project started by Mahama not abandoned, according to the Minister for Information, Kojo Ponkroma. Meanwhile, the K. Buzia era in Ghana's political history is also there, just in case you want to read a number of those introspections. Ghana's political history, always worthwhile reading. The story is well elaborated on the back page. There's also what is going to become the new normal, and featuring Israel Lai. This one was called from myjournline.com. Anchoring from home could be the new normal. You can find Kojo Yankson now going to be permanently
anchoring from home. Social distancing.
Social distancing.
Yeah. I miss you guys, though. I hope they will allow me into the studio every now and then.
Charlie, you can come anytime, man.
But we're expecting your piece as well. What do you think this will be the new normal, working from home?
I think
anchoring from home.
Yeah, I think it can, especially the way we do it, so we're not all at home, but it kind of gives a nice perspective to have somebody anchoring from a location that your audience can relate to, So I can see a lot more of it happening. I don't know if it will become the new normal, as in, every channel you switch to, you see an anchor at home. But, Israel has demonstrated that you can set up a professional studio in your home and deliver from there. So who knows? Who knows, huh?
Wow. I want to work from home, so, Roland. Let's do any picks in the newspapers? Anything that we want to highlight on a bit more?
Well, guys, have you seen the Daily Guide front page? The story about the 13 doctors hit by COVID-19. Yeah, it struck me. This is actually coming from the Ashanti Regional Chapter President of the Ghana Medical Association, Dr. Pakwesi Beidu. He said this on radio in Kumasi over the weekend. He said about 13 medical doctors have tested positive for COVID-19 as they were striving to save patients from contracting the disease. Beside them, several nurses, scores of nurses, according to the Daily Guide, have also been infected. He talked about one doctor who was critical, but luckily his colleagues managed to bring him back from the brink of death, and he is now responding to treatment. But you see, the point of this is that a lot of these doctors are getting infected because they are coming in contact with patients who are positive, but perhaps don't know or don't inform the medical staff. You remember there was all the controversy not so long ago about Obuo, who was accused of not informing the frontline workers when his father was brought into Ridge Hospital. So you can imagine that if this is happening in other instances across the country, it's really putting people at risk. Also, the more of the virus there is in the system, the more of a chance that frontline workers can get infected. And you see, perhaps it hasn't really struck us the reason why it's important to protect the frontline workers. because they are the only ones who can save us.
Yeah.
They are the only ones who are trained to save us if we get COVID-19.
Exactly.
So we can't be losing them. You know, that is just death. You know, spelling death for us.
Yeah.
So I was really concerned to read the
on
story
the AM
today.
show this morning, I actually spoke to a very fine doctor. She's a pediatric specialist, so she's a specialist doctor, and she tested positive for COVID-19. She's recovering, thank God, at home. She shares her personal experience with me. We'll bring back that conversation live on the show today.
Wow.
Yeah, she's a fantastic woman. She's got children. She's married. She was going to work, you know, when under the lockdown as well. And she works in a children's space. So it was a bit tricky. Like, how did she get it?
Yeah.
We talk about
probably,
all of that.
Yeah. Probably from the kids, you know.
Yeah. So
they tend to be great carriers, but they don't show any symptoms because their immune system is so good.
So we have a specialist doctor sharing her experience with us here on the AM show. You've got to stay. We also talk about a very important subject of stigma. You won't believe where people were stigmatizing her, the same facility where she works. You've got to stay for that. Roland, is that another story, or we go to my online?
Well, I just wanted to put all this into perspective that following this, we know that around the world, there are a number of medical doctors. And if you look at the quantums of the numbers, it's frightening. In Italy, by the middle of this month, about 100 or over 100 had died. In the UK as well, a number had been sick and also lost their lives. In the US, nurses and doctors all on the front line. And I think that it's important that we put all these into perspective. It's a good thing that Kojo raised this.
Yeah, Russia also coming up with some numbers.
Yes, just about the last one.
All right, shall we do MyChildline.com? Let's do our page. This is it. Breakthrough as Ghana researchers develop rapid diagnostic testing for COVID-19. So these scientists are the Kwame Nkrumah University of Science and Technology and INCAS Diagnostics. They're both in the Ashanti Regional Capital, Kumasi, and they're currently optimizing the kits for COVID-19 testing. Scientists from the Kumasi Center for Collaborative Research, one of the major testing centers for COVID-19 in Ghana, made significant input into the development, according to the story on MyChildline.com. So we're getting definitely creative. This is pushing us to be innovative as well. So congratulations to the KNUS team and the INCAS Diagnostics as well for coming up with this. Building 94 hospitals within a year is impossible, according to economist Professor Buckley. Details there. Construction of 94 hospitals has nothing to do with COVID-19. It's only a campaign facade, according to the minority. Malaria among top 10 OPD cases in Western North region, but this has to do with a period ending 2019. Not included in that data, as in 2020 is not included in this particular data. We've got issues already before COVID.
And we'll continue to have issues. But I think that what COVID has brought into perspective is how reactive we've always been. And it looks like the way we're going will still be reactive in many decades to come. Maybe Kojo, Mamavi, in our lifetime, we'll see something changing. Or maybe in our children's lifetime.
Well, the signs are not good, I've got to say. The signs are not good. We haven't done much to show that we're capable of getting ahead of any situation.
Well, where our scientists, in the meantime, are doing something that we didn't think they could do or we could do as a country. So I'm hopeful.
Yeah. I mean, I think we also have to commend our scientists. There are a number of things they've done which are great. For example, at Noguchi, they figured out how to collect samples even when they were challenged when it came to swabs and so forth. You know, moving from taking the swabs in the back of the nose and throat to using sputum, which is basically from the back of the throat. You know, and they had great success with that. Other countries have started doing it after the Ghanaian example. So we also innovate quite a lot. And if these new test kits work, that would be fabulous. That would be fabulous because countries are queuing for test kits, you know, around the world. And if we are making them at home, then, wow, voila, we'll be ahead of the curve.
Let's find a little time. Oh, I thought we'll do the BBC. Just wanted to share this strange, mysterious deaths in Nigeria.
Let's do it. Let's do it.
Kano.
Let's do it.
No, we don't have time for that. We have to go for sport. But just to tell you that, well, there are a lot of people dying in Kano. Grave diggers are burying a lot more numbers than they usually would. So the President, Buhari, is putting Kano also under lockdown. So that's among the many things. You can catch details of that on the BBC. Kojo, comfortably working from home, social distancing. We've got to take a break and bring you sports, but we've got lots of things to talk about here on the show.
And right here on the show, we'll be having a great interaction. We want to celebrate frontliners, those at the forefront of making sure that we're able to win this fight for coronavirus. But how do we do that? By recognizing them. Amavi Osobwaji had a great interaction with a now recovered, infected medical doctor, a pediatrician. But look, the very emotive conversation that we need to have about how they are going about their work. Because you leave home, you don't know whether you will be infected or not. And so following that, we also had Komla Adom visiting some of the critical areas of the main hospitals. We have UGMC and then also Kolebu, and interacting with a number of the medical professionals. That we'll be having an interaction on the back of those inserts that Komla Adom provided with Dr. Chris Owu. And I tell you, we're celebrating professionals, health professionals this morning. Those are the front line of our fight against coronavirus. And Mamabi, we have to do also some education and law. What do you have for us?
Well, you know, you remember all the conversation about injunction and all of that. Well, we thought here on the show we will use this opportunity to do a little bit of education.
Good one.
So away from what this person says, what that person says, what does the law say? So this is EI 64. Gets a little mixed up because we've got quite a number of these executive instruments. But this particular one is imposition of restrictions, coronavirus disease, COVID-19 pandemic, instrument 2020. Remember, first, the president indicated the Minister for Health recognized the threat of COVID-19 to life and health and its potential to escalate and cause danger to life and health of people living in Ghana, and exercise the powers conferred on him as minister under sections 169 and 170 of the Public Health Act 2012, Act 851, and declared a public health emergency pursuant to the Declaration of Public Health Emergency Coronavirus COVID-19 Pandemic, Executive Instrument 2020 EI 61. I told you we've got a number of those. So just stay with me on this. Now, the president was satisfied that there exist circumstances which require the imposition of certain restrictions and exercise the power conferred on him and the subsection 1 of section 2 of the Imposition of Restrictions Act 2020, Act 1012. So what are the restrictions? We've got a little bit of graphics to show you as I take you along what the restrictions are. So here we go. 1.1 says there is imposed by this instrument restrictions on A, public gatherings, including conferences, workshops, funerals, festivals, political rallies, sporting events and sporting clubs, private parties, and other social gatherings, nightclubs, drinking spots, and event centers, religious activities in churches, mosques, shrines, and at crusades, conventions, pilgrimages, and other religious gatherings, and travel to Ghana. All public gatherings set out in the paragraph 1.1a of this particular EI have been suspended. So moving on, it also says, and all this is in this executive instrument, despite what you have seen above, a private burial may be carried out with not more than 25 persons in attendance. And this is specific to private burials. Also says, all universities and other tertiary institutions, training institutions, senior high schools, basic schools, public and private schools, nurseries, creches, and such other schools have been closed down. And this is all contained in that piece of legislation. But it also came with some exemptions. So what are the exemptions? That's what you have on the screen. A service, manufacturing or industrial workplace, a market, an establishment in the nature of a supermarket, a shopping mall, restaurant, a hotel, or a drinking spot, the security services and essential services. So when we went under lockdown, we saw these categories of services, businesses open for business. But that also came with some rules. All right. And if you go further, it describes to you what an essential service is, but we can skip what an essential service is and look at the rest of the issue. I want to talk to you about duration of the restriction. So a restriction imposed here is for a period of 3 weeks. This was the very first time when the president talked about this, subject to reviews, which he did, and this was first gazetted 23rd. This was gazetted in terms of this executive instrument 23rd of March 2020. But subsequently, this was extended for another 2 weeks. Remember, it took effect 13th of April. And again, as you heard in the president's address, Sunday evening, all public and social gatherings are still suspended for another 2 weeks. Effective just Monday, 27th of April. But we can't wrap up without telling you what has happened to persons who have flouted, breached this piece of legislation. First, we heard about a pastor and 2 church workers who were sent to the whole central prison to serve a 4-year jail term, each for breaching the ban on social gatherings. They failed to pay a fine of 13,200 cedis each, totaling 39,600 cedis. There's a second one. An Accra Circuit Court on Tuesday, April 21st, fined 6 persons a sum of 14,400 Ghana cedis each for violating the restrictions law after attending a party on April 18. In default, the 6 will be convicted. And they will serve a term of 5 years. So, there you have it.
Great education there, Mamavi.
I hope it helps.
I'm enlightened. I didn't see this before you brought it on air. It was a good thing because I wouldn't have paid much attention. But it's good. All of us stay glued. We have to give you the best of education. And that's what we do right here on the show, Mamavi.
Yeah.
This is going to be a weekly feature, right?
It is.
Right.
So, you know, something else that I discovered. You know, we're talking about accidents, and we've told stories about people who have been involved in an accident and how they got little compensation, you know, for those accidents. I actually read a case which was decided in January, but again, I guess a lot of us missed it. This was by the Supreme Court. It's an incredible piece that I will have to share. It gives us all hope, and it tells us that the people who judge the issues are listening to us. This punishment, well, I mean, it's compensation, but it's so appropriate, unbelievable, something you haven't heard before in Ghana. That's coming up next week, so you have to look out for that.
Well, it's almost like a premiere of a new movie by Mamavi Osobwaje, the producer. Well, and that's where also we have to take you to the UGMCICU. And Komla Adom visited. They had some great interaction with some of the top doctors we have there.
Welcome, Komla, to our intensive care unit for COVID patients. As you walk in here, you can realize there are separate beds and different patients are admitted onto the various beds. There are different degrees of illnesses, different degrees of infection. So as much as possible, we handle each individual patient with as much caution and care as we can. And we try not to transfer the viral load or the level of infection from one patient across to another patient. It's a battle of a sort. It's like war. It's like soldiers going to war. Before you leave to go to war, you have to prepare the minds of your family back at home. We've handled it differently. Some of us have had to separate ourselves fully from our family members. Like myself, currently I'm home alone because some of them are among a higher risk group. If they get the infection, they'll be among the higher risk group. So as a first line, I've had to separate myself from my family for this period. There's been a lot of sacrifices to make. Like I told you, our lifestyles have changed. We've been told our way of dressing, we are not allowed to do so many things. You can't wear jewelry anymore. You can't wear earrings. Things we used to take for granted, we cannot do anymore. You cannot carry certain things on you. When you leave and you're going home, you cannot use public transportation anymore. You cannot expose many people to you because of the area where you have worked. So all that has also changed. Of course, our social activities have also changed. You can't, even though they say the lockdown has been lifted and some people can do certain things now, we are still on our own form of lockdown whilst we work in the treatment centers. And it is not every health worker who would accept to work in a treatment center. This is a volunteer job we are doing. We had to volunteer to come to the treatment centers.
Hello, Mr. A's blood sugar is 8.5.
Mr. A?
Yes.
Blood pressure?
Blood sugar.
Blood sugar is what?
8.5.
Blood sugar 8.5.
Yeah, and we've given 500 of metformin.
Okay.
Yeah.
500 of metformin?
Yeah.
Okay.
As we do our part as health workers to stave this epidemic in our country, we want the citizens to also do their part. And then to pray for us, because it is not with our own strength that we do this. We have seen when this thing started in China, in Italy, in Spain, hearing of doctors and nurses working for hours and hours on end. I thought, oh no, I don't think I can do this. That is what I thought to myself. When we were taught how to wear the PPE, the full PPE, we were told that the maximum you can stay in it is 45 minutes, maximum 1 hour. But you bear with me that when we went in today, we spent more than an hour in there. And Dr. Adai at a point spent more than 4 hours in the PPE. It's not through her own strength that she was able to do that. See, so we need their support as we fight this battle. And we hope that in the very near future, once we get this disease out of our country, we'll be able to jubilate as a country together.
Very inspiring right there. On the back of that, we're going to be speaking to Dr. Chris O, who is National Case Management Coordinating Member in charge of severe and critical cases. Some members of his team, that's what Komla put together for us and brought you excerpt of their activities. It's very refreshing knowing that we have a very solid team handling the cases. Dr. O, good morning to you. Hopefully you can hear me.
Good morning, and to your team and to your viewers.
Great. Well, thank you for allowing Komla to have access and to give us a peek of what you do. I think, I don't know, but there's something about watching and seeing what you do, and it brings a lot of confidence. I am very proud right now.
Yeah, thank you. Thank you once again. It's a teamwork, not by me alone, by myself, a lot of other people working with me, and then, of course, a lot of other people all over the country who are behind the scene trying to battle with this deadly virus and giving our country a chance, especially for those who come severely ill and critically ill. Because they bear the brunt of this disease, as you would have seen from other countries that have had surges in their infection rates.
There's always a critical aspect of trying to go to work, be in a steady mood, etc. And I know that this is a time where the media, both international and local, is bombarding all of us with a lot of things. Now, when you hear that your colleagues, let's say in Italy, over 100 have passed on, Russia, just getting to know this morning, over 69, and the numbers are counting, the UK, America. How do you put yourself in shape before you make entry into that hospital?
Yeah, thank you. Thank you, Roland. First of all, this is not the first epidemic or pandemic the world has seen, but obviously this is in a scale that is scary. The opportunity or the advantage we've had in sub-Saharan Africa and the rest of Africa is that, unlike some earlier epidemics like Ebola or the epidemics in the Congo, where it's basically started with us, and therefore didn't give us an opportunity to learn from what other people have done well and what circumstances increased the number of people who were dying, especially healthcare workers. In this case, because it got to us much later compared to the others, it's given us the opportunity to learn. As we always say, there's no point in reinventing the wheel or making the mistakes others have already made. So we'd watched what had happened in China. We watched what had happened in Italy, Spain, and then more recently in US and the UK, and basically started putting our plans together. We've been mindful of the fact that our health system is not as robust as those countries, and therefore, if we do not prepare early, and if we have very significant numbers of people falling critically ill, that the healthcare workers were going to be overwhelmed. Not only were they going to be overwhelmed, but we were going to start reporting mortalities that are similar to what's happened in those countries among healthcare workers. This meant that we needed to learn very early what protected our healthcare workers. We needed to learn early what have they tried to protect themselves that didn't work, and how to modify that, how to make ours a little bit more robust. We do not have as many numbers of healthcare workers, and certainly nowhere as many critical care workers as any of those countries. So we knew that this was not going to be a suicidal attempt, but we needed to plan way ahead. And I think that's what we've attempted to do in trying to identify facilities that we could use to start up, knowing that most of our facilities that had intensive care units were already saturated, in trying to identify healthcare workers, train them, and prepare them, simulate what we're going to do when it happened. And then, of course, when it did happen, we have had to learn as we go on, modify what we're doing, and improve on that. And that's what has brought us to where we are now. But having said all that, it's still very important to know that irrespective of how low the percentage of people have severe and critical illness are, that it is a percentage of your total number, so of infected people. So if we continue to have a surge in numbers, that number is going to escalate. When it escalates, it's going to overwhelm even the critical care workers. We're able to contain that now. We're able to turn out quite good outcomes at the moment. But that is partly also because we're able to contain what numbers we have now. So it is our plea, even for those of us who work in intensive care units, that we need to stop the spread. We definitely need to stop the spread. Yeah. Okay.
And I see that just on your roof, it looks so beautiful, like some of those hospitals I watch on YouTube, either in the UK or in the US. But since you have great experience, and you mentioned that we needed to make sure that we stem the tide because of where we are, because of our health systems. How terrible, based on your independent and very passionate observation, is our health system then?
Yeah, it's a bit difficult. We know that our health system has not been the healthiest of health systems. That is no secret to anybody. We know that we've struggled to replicate what you've seen in UGMC, University of Ghana Medical Center. This is a beautiful hospital, very beautiful. Pamela will tell you. But we know that we've struggled to replicate that. And replication of it is not only in facility, but even more important for a lot of us in specialized manpower, specialized healthcare workers. A hospital is a hospital basically for the good of the people, only if it is well equipped and if it is properly staffed. So as a country, we were really nowhere near there. It's difficult to actually put percentages or to put exact numbers as to what was available. So that even tells you how difficult even collecting data as to the capacity of our hospitals to deal with different disease conditions and the capacities of our ICU. I had to do that for WHO. And it wasn't an easy task to actually get the capacity, but not only the capacity, but the functional capacity, because that's really what takes care of people. It is not how many ventilators you have. It is how many ventilatable beds. In other words, even if you have new ventilators everywhere in this country, we're not going to ventilate everybody. If people ventilate people, ventilators don't ventilate people. Somebody has to, we have to have critical care nurses, we have to have respiratory therapists, we have to have the physicians, the pulmonologists, the anesthesiologists, the critical care doctors, the surgeons, everybody properly prepared to deal with this. This is actually a lesson to us as a country, that if we do not learn the lessons of the weaknesses of our health system, especially in taking care of our acute and critical care going forward, and from this and rectifying that, then we have actually learned absolutely no lesson from this pandemic.
Dr. Owu, your place is also just the only one that we have to take care of critical care patients of COVID-19, correct?
No, absolutely not.
Okay.
So there are a number of ICUs that have admitted patients so far. We created the first ICU that took in COVID-19 critically ill patients in the East Municipal Hospital in Kwabenya, which was actually a hospital that was waiting for, had just been, I think, commissioned a couple of months ago, and the staff were preparing to start off in the first week of April. Fortunately, during that time, we were looking for capacity, and as National Case Management Coordinating Team, we were asked to look around to see where we could send people who were ill, because the intensive care units in Korle Bu Teaching Hospital, in the 37 Reach, in Komfanoche, and other places, already had an overwhelming number of patients because of the low capacity. So we needed to find somewhere where we could move these patients and not contaminate everybody in the process. Remember, that was at the beginning, when some of the lessons we know now, we hadn't learned, and it was important to do this safely. So we turned that hospital to our biggest national center. We actually created a 12-bed ICU, of which 4 was functional, and that was where the first few cases went. And then while we're doing that, we were also in discussion with the management, the CEO and management of University of Ghana Medical Center to use both the hospital and the intensive care unit to receive patients, which thankfully we were able to do. And therefore, between the East Municipal Hospital ICU which we created out of a delivery suite. And that's how, totally out of a delivery suite in a period of 3 to 4 days. And the ultramodern ICU that you have in UGMC, we were able to take care of over 90% of the ICU patients. Okay. And while we're doing that, Korle Bu Teaching Hospital also set up the medical ICU, where we've been able to take care of one patient and discharge another patient currently. We're still in the process of identifying, increasing the capacity, both equipment and manpower of a number of other hospitals like the Greater Accra Regional Hospital, the 37 Military Hospital, and the other teaching hospitals such as Confanoche and the regional hospitals. Okay. But yes, it is not the only one. The ICU patients have been admitted at least to 3 or 4 of the ICU so far, I think. But the majority has been these 2 hospitals.
Okay, so let me understand. If you're too ill, I don't know if there's anything like that, you'll be taken to any of the centers that you described.
Yeah, so we actually grade, because basically if an infection is an infection, but it's not everybody who has an infection who is ill. And that is what we mean when we talk about people who are asymptomatic and those who have symptoms. So those who are asymptomatic is just like me and you, or even healthier than me and you, walking about. And apart from the laboratory tests, we would not know that they have a disease. Majority of those are those we had kept in quarantine, isolation to retest them and observe them. And then if they got ill, then we needed to give them treatments. And thankfully, a greater percentage of about 80% of all patients who are getting infected with the SARS-CoV-2 virus fall into that category. Now, those who are ill, we grade them to mild, moderate, and severe illness. Majority of the mild illness are basically having a headache, maybe a temperature, maybe sore throat, but nothing escalated. They do not have a pneumonia, which is one of the hallmark complications of COVID-19. So most of this, again, we can treat in isolation, not requiring a lot. The problem comes in when people have chronic medical conditions, such as diabetes, which we have found in our population, especially the critically ill population, to be very significant in determining their outcome. And of course, hypertension and all that chronic diseases, asthma, sickle cell disease. This group of people, even when they are not very ill, already are falling into moderate illness because they may have a pneumonia, and then coupled with their comorbid conditions or their chronic illness, their risk of getting much more severely ill is quite high. Then, of course, there are the group who have severe pneumonia, and that's what we call severe illness. And this group needs to get into not just hospital, but into critical care. Some of them get complicated with basically their lung being totally messed up. They are requiring assistance to breathe. Their kidney being messed up, having severe infections, their heart being affected, their brain being affected. We've seen basically all these manifestations in our patients. And these are patients those who are severe and those who are critical are those who are requiring intensive care units. And that is where my team and myself basically get significantly involved.
Okay, so how many of the critical care patients do we have today?
All right, so today we have actually 8 critically ill patients that I am aware of in Ghana, 1 in Korle Bu Teaching Hospital, medical ICU, and then 4 in UGMC, and then 3 in Ga East Municipal Hospital. In a total, I think we've had about a total of either 13 or 14 patients in ICU. But of course, we've had more patients with critical illness who did not get admitted in ICU, especially at the beginning of this pandemic in our country, while we're now sorting out our ICU. So the earlier mortalities, unfortunately, who could not get into ICU. What you should be aware is basically everybody who has died from a complication of COVID-19 was severely ill. As I said, not all of them got into ICU because that was at the very beginning, and even getting to know a couple of them died at home, others even before we could escalate care. But since then, we've had about 13 patients, I think 13 or 14 patients in ICU. We've successfully discharged five of them now, who were very ill, requiring significant care by doctors, nurses, and other health professionals, and of course, a multidisciplinary team of healthcare workers. We have unfortunately lost 2 of them in ICU and a third one that arrived basically in ICU with a heart stopping on arrival. And unfortunately, we lost that one. So we've had a total of 3 of them reaching ICU and dying here.
Now, when we say critically ill cases, and we look at what is out there in the international media based on what the reports are, because we haven't visited, how does that compare to our cases in the stream of diagnosis or epidemiology?
Yeah, again, we've been spared a bit, but I use that very cautiously because our numbers have not significantly escalated. There's still a lot to be discovered about this illness. There's still a lot to be discovered about this illness, what it does in different populations, including our part of the world, which had not been significantly investigated. But we know that a trend has not been totally different. About 5% of all ill patients, of all infected patients, would require management as severe and critically ill, even from other countries. The percentages that are dying is showing excess deaths in excess of the percentages we're talking about. And that is what we refer to the system being overwhelmed, and particularly the critical care system. At the beginning, for countries that have robust critical care, intensive care system, they're able to handle what numbers come in critically ill. Some of these may need life support, may need other support to their systems. But as the numbers keep increasing, what we have seen in even very developed countries is that the healthcare system and the healthcare workers are overwhelmed. When that happens, what happens is basically not only are they rapidly losing at a greater percentage those who are critically ill, but they are actually not able to admit those who are moderately and severely ill into appropriate care. And most of this would actually deteriorate. When they do, you're actually having numbers which die more than numbers that are critically ill. And that is that. Now we have roughly about 1,600 people, I think 1,550, if I'm correct, yes. People infected, of which, as I said, 7 of them in ICU at the moment. All 7 of them are doing fantastically well. A couple of them have been with us for more than 20 days and getting ready to go home. We're discharging one home today from UGMC and probably discharging another one from Ga East very soon. But again, and that's why I say cautiously, because I have not exceeded my best capacity both in Ga East and in the UGMC. I have not exceeded my health care worker capacity, ability to intervene appropriately. But when we get there, that could be significant here.
Okay, great. Anybody on ventilator?
No, we don't have any patient on ventilator at the moment. I know there's been this significant question as to people dying more when they're on ventilator, and therefore should we be ventilating them? So I just want to speak briefly to that because the practice of critical care, intensive care medicine, has not significantly changed What has changed is the numbers that are being dumped on the system, and the fact that we are doing this in an infectious disease setting. Therefore, we need to be careful not to contaminate patients and not to contaminate staff, and not to cross infection from one person to the other. But the practice of critical care, as it stands for generally, has not changed. There are things that are specific to COVID-19, which we have learned, which we are tackling. But we do not put patients on ventilator if they don't require to be on ventilator. In other words, what I'm saying is that majority of patients, even before COVID-19, who get on the ventilator is because giving them oxygen by more simple means of delivering oxygen, including non-invasive ventilation, are not expected to work. These are patients who we may have tried non-invasive ventilation or given them oxygen, including high concentration oxygen, and who have still continued to deteriorate before we put them on the ventilator. In other words, we are talking about a population of patients who their mortality is usually between 50% to 80%, depending on how many organs are involved, or in some cases, almost 100%, even before COVID-19. So the mortalities or the death we are seeing from ventilated patients is not just because we put them on ventilator. It's because they are terribly ill. Okay. They are terribly ill. Significant number of their system have shut down. Okay. And we would expect of any other condition. Now, ventilation does have its consequences, including even transferring infection to other parts of the body. And then, of course, the effect of pushing air, which is not physiologically how we breathe, into you, and its effect on other systems. And we know that. So there's been a lot we're trying to do in seeing other modes of getting that oxygen into people without necessarily intubating and ventilating them. Okay. But the most important way of doing that is basically picking them up earlier before they need ventilation, being aggressive with their management when they are moderate and severe. Okay. Being able to prevent us to getting to the stage where they need ventilation. Okay. Of course, if they get to the stage where they need ventilation, we will be forced to ventilate them. All right. The mortality is not pretty.
One last question before we wrap up. It's a curious question of how are we treating our patients? What are we using? I remember hearing of the chloroquine. Are we still trying new things? What are we doing?
All right. So we have a national treatment guideline for COVID-19 that has been approved by basically the institutions and the committees that sat with them. We wrote, as a team, wrote the National Case Management Guideline that is been circulated, and then it's been accepted for our country. At the moment, our treatment regimen, yes, is still on hydroxychloroquine, chloroquine base. Okay, so we still use hydroxychloroquine and chloroquine, and then azithromycin combination as our first line for every patient who is requiring treatments. We are mindful that this combination may have some side effects in some groups of patients, and therefore patient selection in its use is been implemented, reviewed, and that's what we're doing. As to whether patients who are going home to do home care and who have cardiac or cardiovascular diseases should get that, we have guidelines that's stress of what we're supposed to do. Okay. Now, for those who are severely and critically ill, in addition to the hydroxychloroquine, chloroquine with azithromycin combination, there are other additions such as the antiretrovirals and the ritonavir combination and the remdesivir. But it's important to stress that the availability of this, even in our country, is problematic at the moment. We do not have remdesivir at all. And unfortunately, we haven't been able to use the antiretrovirals in our patients. There are other treatments, especially for the critically ill patient, that have been discussed and still there are dialogues ongoing. Okay. In whether they have any significant effects and then what their the benefits vis-a-vis the problems with them are. And this will include things like a few other antiretrovirals. There's doxycycline, which is being used by a few of my colleagues, which is an antibiotic, and then basically things like anti-interleukin 6, and then of course convalescent plasma and whole blood, which is being shown in other populations of critically ill patients to also have some benefits. We're looking at all this. There are a few studies being drafted and some running in other countries, which we are following quite keenly, and some that are in the early phases of getting approval in our country at the moment. Whatever works and proves to work, we are very happy to discuss, bring on the on the dialogue table, and help our patients with. But we are also mindful that there are many claims out there of things that work that has not been shown to work. Again, just to mention, because we are Ghanaians, we are Africans, and I'm quite aware that there are a few people also looking at a number of our local medicinal or plant-based remedies, and we are happy to look at reports that involve this, and if they have beneficial effect. Most orthodox medication are originally plant-based, so a lot is going on in the background.
Okay. All right.
Trying to find a vaccine for this ailment. Yeah.
Okay. Doc, we have to leave the conversation here, but thank you for the insight. Thank you for talking to us. This is rare, so we really appreciate it.
Yeah, Roland, just before you guys go off, I think I can't get on air and not appreciate the role of all those who are involved in this. But this is not me alone. There are loads of health workers, non-health care workers. There are people in public and private. There's been private sector guys who pitch camp in our base in Ga East, trying to help us set up, build a 100-bed facility in conjunction with the government of Ghana, and in a period of 6 weeks. And our hats off to those guys. Also to all the, I don't like using the word frontliners because I really don't know what that term means. I have difficulty in defining it. But yes, there are healthcare workers who are both involved in the management of patients who are confirmed COVID. And a lot of these guys are here working with me, not only in the ICU, but in the mild areas, making sure that these guys do not get severely ill to require admission into our ICU. But in almost every hospital now, there are isolation centers, there are a number of other treatment centers, REACH, TEMA, 37, Korle Bu Teaching Hospital, Kamfanoche, Kumasi South, and all the regional hospitals are busy setting up all this. There are other ICUs that have indicated their preparedness to help us, even from the private sector, Focus Hospital, Nyaho Medical Center, who have shown commitments to assist us in doing this. There are medical organizations, nursing organizations who are spurring their members on in this battle. And of course, administrators of all the hospitals that we're talking about, they may be in the background, but they give us the space and the resources to do what we're doing. All the security services, the military, the police, and all others have been very helpful in assisting, contain what we're doing. I know I can't mention every single person, and I'm not going to try to mention even specialties or medical specialties. But of course, even teachers, including a lot of us. I, for example, I'm a teacher in the University of Ghana Medical School, like a lot of my other colleagues who are teachers, but also doctors. But I find themselves either having to lead or having to help with this pandemic. And the Ghanaian in their home, who we are basically pleading with, that if you don't have to go out, kindly stay home. If you have to go out and you have to go to crowded places, you have to go to places that you have to make contact, wear your mask as the president has said. If, as much as possible, do not stay in crowds. As much as possible, follow the hygiene etiquette, both hand and cough hygiene etiquette. Wash your hand as many times as you have to. Use alcohol-based hand wraps to decontaminate your hand. And look after yourselves. This is real. It is definitely real. We may not be in a crazy number now where people are dying without help. But that is exactly where we don't want to get to.
Absolutely.
We will be overwhelmed if we do. And of course, the media. Roland, I'm also going to forget you guys because you give us the platform. A lot of us do not have the opportunity. Not that we don't have the opportunity, but basically busy most of the time. I know yourself, Komla Adom, Israel Lai has been chasing for this for quite a while. But we know what you guys are doing in the background. We know you've given us a platform to speak to other Kenyans. We thank all those who've donated and keep donating to keep us safe, both from government and then, of course, from the private sector and groups, including individuals. We want to say that we appreciate what you're doing to give us the opportunity so that we could help Ghanaians. Thank you guys very much.
Well, Dr. Chris, so now I know the face from years back. And after all this COVID experience and you have time, we'll eat some banku.
We will party. We will party hard.
We will do that. Party after party. Party after party.
Yeah. The man is trendy. The man is trendy.
Party after party. Dr. Chris O and your team, we salute you. We'll continue to salute you. Thank you for speaking to us.
Thank you very much.
All right. So we've been talking extensively to the National Case Management Coordinated Member in charge of severe and critical cases, Dr. O there, and of course, Komla Adom, allowing us to step into that ICU with him. I hope you've enjoyed yourself. We've given you an insight as to what's really happening. I'm excited about this. I don't know why I'm too excited, but we continue to salute all the health workers, all the frontline workers here on Joy News. It's now mandatory for everyone to wear a nose mask. How are people complying with this directive? Let's go live to Kumasi. Kumewu Nanayao Jima is our colleague. He joins us live. Nanayao, what can you see around where you are, and how do you report what you see?
So, Moavi, due to the pandemic, we know that now social distancing, regular washing of the hands under running water and soap, and also the use of sanitizers are the various protocols that we have to observe to reduce the spread of the pandemic, the virus I mean. And today I'm here at Kumewu, and we know that now the use of face masks have become part of the protocol, and it's become compulsory in this country. No matter where you are supposed to be wearing face masks. So I'm here at Kumewu, the taxi rank here in Kumewu, and I would want to interact with the drivers here and find out how they are observing social distancing as well as using face masks. Mamavi, before I speak to them, I'm yet to see more than 10 people in the face mask. It means that this protocol is not being observed as the others. Even though I see Veronica buckets, I see soap, liquid soap, which people are made to wash their hands with. The use of face mask here is not being observed. So I have with me this taxi driver. Let me talk to him and find out why they are not using the face masks. Bro, good morning.
Good morning.
Me buy no me drivers me hu piwa ha. Me hu ya me hu nipa be 10, 15. Nipa ba ko pe and one say o face mask ni bi. Aden.
The hu ni say face mask no enye obia like doctors no do me am say em fan use no. Bi cut entuma ni ade na entuma no so you be an pay on say omo de chemicals na entuma no. You be answer pay say chemicals na de to bi o ha. If you know yali be cry, and apart from this colonial virus on the bayana, be a sent to the couldn't be between man yali frana. And today, Pana person can the amount now the use. Oh, thank you, the enemy thank you. Doctors know better the use. say because maybe I remember the back pa the ntoma you meet me using the biara sa say bia o use we endawi ade che no use we da woforo o mi obi dey bi mo want ntoma de ni bi what me comes this year.
Okay, so he tells me he has one of the locally made face masks, but he's not wearing it because he feels that he's not safe in it, especially that they use local fabrics to do it, and these fabrics may contain some chemicals that he feels will not be good for his health, and that's the reason why he's not wearing it. Let me interact with one other who is in the face mask and ask him why his colleagues are not wearing it. What the most colleagues but I didn't think show.
The time we did say, me who's a mobile into Namco Fashe, and come find shit. Now, mobile, no more say, in favor be nose marks in the one will be no more come. Now, and to manage the and to mind the young who say, and get safe. I know getting said the cashew, and the Bilan carriers and Cabano. About one uncle, Chibiama, Adawa for Nina.
Enti uhumeno ena ma say na some chin agencies na ma say
me hu one na ma me say ena bi o sa twen agencies say ha yen shebi no obi but o e kan mu ena bi a police for na kichi enti na ya pempam we nu ntia enti ma dia no so ye hu ni say like e mo ye hu ban yi papa na she no ena bi na nke ye but ye nya bi enti o me hu ye.
Okay, so he's telling me that he saw me in my nose mask, and I also drew his attention to the use of nose masks, and this is the reason why he went into his vehicle to pick his own and wear. Before then, he wasn't wearing the face mask, and also he bought it because of the police. He says the police are on the road, and when they see them, they ask them why they are not wearing them. So the police will not allow you to go through or go to wherever you are going to unless you're in the face mask. And this is why he intentionally bought a face mask. So, but for the police and other enforcement agencies, none of these drivers will buy the face masks to use for themselves. So, Maravi, I can report that the use of face masks is not catching up here at Kumawu, especially in areas like Kumase. You have the city authorities and security men at Kejetia and other areas of the Central Business District forcing people to wear them. But Kumawu, aside the drivers who see police on the road and due to that they wear, a lot of the people, indigents, market women, it looks like the law on the use of face masks or the protocol is relaxed here at Kumawu.
Just before you go off, is it that they have the mask in the vehicles? Do they have it in the taxis?
If I could hear you correctly, you are asking whether they have some in their vehicles. Yes, almost all the vehicles you see lined up here and the people here, they all have the face mask. But they say they don't feel protected. They feel the ones they have are inferior. So if government would want them to wear it, government should give them some of the face masks for free, especially the surgical ones, and which are out there, so that they will wear and feel protected. But for what they have, that's the locally produced ones, they don't feel safe. I see one man here wearing a surgical one. I want to ask him where he got it from and why he's always putting it on. Because when he drove in here, I saw him in his face mask. But we saw because unyanum nya isu ntuma onkwa dey different.
Aye, me for cho me dey na me use no. Me your construction work. Enti before man dey ma me. Enti me use kura ansana problems na beba. Enti me mom dey me use we na check akra bet.
Because you should see.
Who's out of can be still now face mask. Maybe I should be a shako.
Me for cho aye. Maybe I could be a shako.
They have
because I say aliaba ti protect ye ho. Ti me protect me say me nya yale no. Ti be bia me se bia me ko bia no. Me shako bet kakra me kan say. Entuma ne dia no a omo pam no. Tele ni bia ti me pam bi e de babonten. Enti amane yusu no, nyi obi a ne feso yusu sa de no. De me se kakra say aban moa.
he's telling me that he has this face mask he got from his foreman. He used to work as a construction worker. So he's been using it even before now, which we've been advised against, especially with these surgical ones. We've been advised, not to use it, not to reuse it.
So
but he is reusing his own.
Okay.
And he's been...
No, I just wanted the clarification. He's got one mask which he's been using over and over again.
Yes, that's what he tells me. Pacho, let me ask him again. Pacho, where are the be I say?
The Pacho, there be media etare. And he said, where fear, number you not for another one. Number you so bet last one aka and the shame to you are mean you be fancy.
And you know, say a fee now, what's the son? No, also, and how many times? And son, what's the son?
Mission 1 week. But must be a steel bender, and I'm side driver. And to me, still working now, and I'm used to say,
you know, it's still working, and one is so that's using.
The music is and the find you still work. Yeah, my dodo. Into my use one, as a 10. In my use 20, the last one, in the use, and I say, yeah, I'm not watching.
So he tells me that when the pandemic broke out and we advised to wear these face masks, he had 3, which he has been using, and he used one for at least 1 week, and after the week he disposed it off. So the one he's using now is yet to get to the week period that he has given himself. So immediately it gets to the week, he disposed it off, and he may try and find one of these locally produced face masks and use for his activities.
Okay. Nanaya, it looks like you have a bit of work to do off the camera. You have to do some education. You can't wear that mask for a week. But Nanaya Ojima telling us the story, painting the picture for us as he's witnessing in Kumewu. Nanaya Ojima is my colleague. We've been live from Kumewu with how people are complying with that directive to wear the mask. Now, in the midst of the global coronavirus pandemic, academic work has migrated online as schools remain closed indefinitely. But not all families have access to electricity, television, phones, and computer to keep up with virtual learning, especially people in rural areas. At the Western Regional town of Banso, final junior high and senior high school students are worried that they may fail their final exams as they cannot access learning online. Joy News' Henry Kwesibedu has the rest of the story.
The world is almost at a standstill following the outbreak of the dreaded coronavirus. Education has been badly affected too. With schools in Ghana now closed indefinitely, lessons have been moved online. Studying online is now the new normal in many urban and middle-class homes in Ghana. But the situation is different in many rural communities where access to electricity and internet remain a struggle. Virtual learning in these communities is not feasible. Banso, a community which is some 30 kilometers away from Western Region capital, is no exception. Many children loiter freely without any care. They said they have no idea that school continues online. Some JHS 3 students sit together, engaging in group discussions. They are worried that basic education certificate examinations may start immediately school resumes.
Sometimes you don't even know what to learn because the textbook have been a lot and you don't know even the subject or the topic, the actual topic you have to go for.
That's 15-year-old Anita Kwam, a BECE candidate. She has been home for the past month helping her mother to operate a local eatery in the community. With no access to internet, she is worried her performance in the upcoming exams would suffer.
We are even scared because we have not done with our syllabus, and sometimes we have to struggle because we are going to write a BECE with the cities, those in the cities that have access to the internet. And because we in the village, we don't have those access to the internet, so it makes our learning very difficult. And we pray that this disaster should come to an end before the day of our BC comes.
Al Hassan, Senior High School 3 student, is worried. He tells me it is a real struggle learning on his own, as some topics need further explanation and direction from tutors. With no access to a television, phone and internet, he struggles to access online lessons.
It is very, very difficult for us to learn. Sometimes, especially the calculating subject, they say the accounting, the costing, and the commat. You solve some question, you suffer, you try it continuous, you solve it and you are not getting the answers. Sometimes you have to get a teacher or someone who knows more than you to teach you. But look at our locality. If you look around, who are you going to consult? And some of us too, our background is not all that good. And I've heard that they are learning going on online in television. And I don't have television at the same time, I don't have phone. So like, it's very, very difficult for us to learn.
Al Hassan aspires to be a chartered accountant in the near future, but he is worried he may not pass the WASSCE if the current situation persists.
My goal or my aim is to become a chartered accountant. We are trying our possible best because this race is not easy. You take it for the whole Ghana, going to write the same paper and look at what I'm facing now. Some people are there learning, using their phone here and there.
Henry Kwesibedu's reports. That's the reality on the ground. What's the response to it? Fortunately, we've got the spokesperson of the Ghana Education Service, Cassandra Chum Ampo, for joining us. Roland, to have a conversation. Cassandra, good morning.
Both of us.
Good morning, Mama V.
And Roland too is here. Don't be biased.
Good morning, Roland.
Well, Cassandra, hopefully you were watching that story as narrated there. So the situation is not it's not equal for everyone. I mean, this issue of the pandemic is bringing out the inequalities. So online, not everybody can graduate to online. What's the alternative, Cassandra?
Thank you, Mama V. Good morning to your viewers. And yes, we have started these online sessions, and we have also engaged some TV stations. Of course, we have even submitted a letter to multimedia to give us a time. But just like the story, showed us, we also acknowledge that there are some who may not have television and access to internet, and that's the reason why we have also started discussions with some community radio stations so that at least they can have their radio. Even if you don't have electricity, you can have a radio that would probably use battery, or these days we have these solar radios. If you have one, you will be able to tune in and then listen. Yes, we acknowledge that, in fact, we never dreamt of this pandemic. It has just come to hit at us. And of course, we are all trying our very best to ensure that we take teaching and learning out there. But again, these are some of the challenges that are coming up, and management is really looking at it. But as I speak to you, we have gotten feedback from some local community stations, and we are very hopeful that very soon we would also migrate onto the radio online radio channel, so that we'll have our community people also getting access to teaching and learning. In the meantime, we have started with senior high school, and we'll soon add on the junior high school and then primary.
Okay, so the plan in the future is to take the virtual learning to local television and also to radio. But what timelines are you working within? Because, these students know exams will definitely happen, and they are nowhere ready. They don't even know what to study.
Yes, we are on it. I can't tell you a specific time, but I know that very soon, because we are almost done with the recording of the GIA for Senior High School is ready. It's just a matter of finishing the talks with these radio stations, and they will give them the content to play on their radio and then to air on their television station. We are even waiting for you, Mama V Joy, because you have not responded to our letter. Yes, we know that you are doing a fantastic job on the Joy Learning platform, but this is our own is based on our syllabus. So we are waiting for them. Senior high school is ready. Very soon, JHS and primary will be ready, because the teachers recording are almost done. And so we know that pretty soon, and we acknowledge the timelines too, that they need.
Just to also say that the Joy Learning is also based on the syllabus as well, the curriculum, but that's obviously to complement the national one as well. So. But the letter you're talking about, we are nowhere near management, so that will be dealt with on another angle. But Roland, anything you want to ask?
Yes, there are critical things that even for those who have access that would need, for example, access to data, because it's a key consumption resource. So how have you been able to negotiate that with the telecommunication providers?
Yes, I know the ministry had some discussions with Vodafone, where if you sign on with the Vodafone, it's free. And so we have some discussions going on at the ministerial level. But that is the reason why the access to data is also the reason why we are on television, so that if you don't have, or if you have challenges with your internet, or if you don't have enough data, you can quickly go onto the television. We collaborated with Ghana Broadcasting Corporation to have the Ghana Learning TV. DSTV has come on with the channel 315. We have Gold TV coming on with 150, Star Times 312. And of course, we have other media houses that have also come gotten in touch with us, and very soon we'll be streaming on their networks too. And so if you have a challenge with data, you still will not be cut off. We will try as much as possible to reach all our target students.
So what would it be then? Would it be a one-way kind of learning, two-way? Would you be able to ask questions? Would there be quizzes and things like that? What's the plan?
Yes, we have on the platform, for instance, we have teachers, about 40 plus teachers on standby that you can quickly send a question and then they would respond. And they are there ever ready all the time. When you send them questions, they respond.
So as you graduate to TV and radio in particular, how would that look like?
Yes, for the TV, and that's why we still have that platform where after watching, of course, once it's TV, you cannot be asking questions just like we are doing via Zoom, like right now. And so you would have to listen and then get through it and then note down your questions, and then another time you get it to us, and then it will be answered. And of course, we have also made sure that we go through the processes step by step. That is getting or teaching whatever concept it is. We break it down into very simple terms to ensure that wherever you would be able to understand. And anytime we move on to a next lesson, we go back to the previous lessons to ensure that even if you did not get concept A right, the revision period will also help you before we move on to the next level. And so there are measures put in place to ensure that people understand, our students understand whatever we are teaching on TV, so that there will not even be a need for it. But of course, there will be questions. That's why we also have our teachers on standby.
Okay, well, we'll continue to monitor that and give you the feedback and try and get some answers when they come up. But what's the bigger plan? Will exams come off? I mean, the virus is still with us?
Yes, Mama V, we know that WAEC has suspended WASSCE. Of course, WAEC is not done. Yes, we don't do WASSCE alone here in Ghana. We have other African countries, and so at their level, they had some discussions, and it's been suspended for now. We do not know when. And BEC is done locally, We are still, the ministry is still in talks with the relevant bodies. As I speak to you, there hasn't been any definite decision as to whether BEC will come on or it will not come on. But until now, we are hoping and praying that whatever learning we are taking, teaching and learning we are taking out there, our students will receive them. And then we are hoping and also praying that COVID-19 will leave us soon so that we'll return to our normal.
Cassandra, when would the decision... Sorry, when would the decision be taken, or when should we expect a definite decision on the BEC?
Well, that would be at the ministry level, because we as Ghana Education Service, we are just an agency and we still have to liaise with the ministry, and we can't take that decision alone. But I assure you that there's a plan B. So whatever it is, if COVID-19 does not leave us anytime soon, and if probably June should even elapse, because we know that in June, WASI would have ended by the first week of June. And then second week of June, we start BEC by then, and all of these, we have not been able to write the exams. We have started some discussion. I know the minister has put together a team to look at the other option, how to assess our students to move on to the next level. Okay. And that's what is happening now.
All right.
Well, before we let you go, there was this perhaps a suggestion by Child Rights International that you should use their assessment. Has that come to your attention for consideration?
Well, that could be an option. Of course, they have been in school all these while. They've been writing class tests, they've been writing class exercises, so the assessment is there. Even at the final exams, what we give for BEC, for example, and even WASI, there's a percentage of their assessment that is added to their final exams. So while we don't have anything to, help them move to the next level, definitely assessment can be done. So that is also not out of place. And I'm sure the team meeting will consider all of that. And at the appropriate time, it will be communicated.
Okay, my last question. Yesterday we had that interaction, and broadly, now it's been concluded. Coronavirus has changed the way we do things. How is this going to be part and parcel of our teaching and learning going forward, even if coronavirus is off?
Yes, absolutely. And this online or virtual learning has come to stay. And let me say that even before COVID-19, we had some of our schools under Secondary Education Improvement Project, that's our SEEP, already on the iCampus GA, that's the online platform. Because these schools, we call them the less endowed schools, were being supported by the World Bank, and so they had iBoxes done by CENLOS, Center for Distance Learning, in all the schools, and it's an offline device that you can get access onto the system and learn. And so this situation has made us enhance on the process. Fortunately, the channel given to us by GBC has also come to stay. And so after COVID-19, we are going to continue with our virtual learning, and then we hope to make it better. Because once we have started, we are also identifying challenges. And so we are going to work more on it and make it better. So this has come to stay. We are going to continue to do this so that together teaching and learning will be effective.
Cassandra, we thank you for your time this morning. Thank you very much. That's PRO of the Ghana Education Service, Cassandra Chum Ampofo.
Good morning, my name is Kadi and this is Showbiz right here on the AM Show. Now to my very first story. Manager for Product Development and Investment at Ghana Tourism Authority, Ben Anani Nsia, has disclosed that there will be a virtual launch for Beyond the Return program. He says programs for the year will still come on, but may not be as packed as last year's.
Plans for a big launch, so unfortunately the COVID has thrown some of these things a little out of gear, but they will happen. See, the thing, what COVID has taught us is that the world things can be done virtually, so the strategy will change a little. The launch will still happen. There might be a little more virtual component and so on, but the programs and actions and events and so on for the year and the subsequent years will happen. I can't give you specific details for now, but they will happen. And we probably may not see as many events packed together like it happened last year, but because we have a 10-year run. You don't run a marathon the way you do a sprint, you know, but they will be more impactful, they will be more engaging. But some of the things we try and institution.
Now, acting president for Musica, Bisa Simons, has described Kidi's collaboration with Jack Knight as a step in the right direction. He told Joy News the project will help put Ghana on the map.
I was very excited because, you know, as musicians, anytime we collaborate with another person, we take our country to their country and to the world, especially with America, because, you know, when it comes to marketing, they have marketed for a long time and their music is all over the world. So I see this as a door opener as Kidi gets in there and do a collaboration with them, and who knows what's going to happen next. People will see that, hey, we have talent in Ghana, let's go there and tap, you know, some of the talent in Ghana. So it's a great thing, and I know a lot of people are going to follow suit.
That's all we have for Showbiz for today. My name is Kadi.
I was